And we are back. I'm Sharon Patty with Christine Bentley and Kate Wheeler on What She Said, and joined in studio now by Dr. Peter Bray. Help us figure out how the milkshake could bring our boys to the yard. Welcome to What She Said.
Thanks for having me.
Well, we are heading into summer, and I think I can speak for a lot of women when I say that, when I'm taking a look, and you're going to bathing suit shopping or whatever, and you're looking at your body.
Which is the worst.
It is the worst on everything, but I know I'll look and think, I sure wish I filled out that top better. But I think a lot of women, if there's one thing they would like to change, it's got to be one of the top choices, is their breast size, whether it's larger or smaller. What are the differences? Like when people talk about, everyone goes, I want to get my breast done, but whether that's enhancement, enlargement, what options are there?
There's a huge number of options, and it is one of the most popular cosmetic procedures women seek. And it can be an increase in size, either larger or smaller, or a change in shape. Now, often that means a lifting of everything. And often a combination of those things is very popular in my practice.
And do you find that sometimes it's a factor of aging? I mean, we hear a lot about young girls coming in to do this, but is aging largely a factor?
It's a huge factor, and my practice is more mature women who are after their babies, after pregnancy, or a little older. They've been noticing changes and want to have something back more like it was when they were younger.
So when is the best time to have this done? If you're let's say an older woman, more mature, would you wait till after you had your babies, for example?
Most women do, yeah. They've had their babies and aren't planning for any more. But that's not always the case. I do see a lot of young women who've lost a tremendous amount of weight. More and more, that's a factor these days. And as the weight is lost, everything starts to sag and to drop a bit. And, they're looking forward to their later 20s and 30s and having their shape restored after the weight loss.
So what's changed? I mean, I didn't even know that I don't know about you, Sharon. Did you even know there was an option in different shapes? I knew there was an option in sizes, but
types.
And there's types. And changes in types, which we'll talk about in a minute. But I didn't know there was an option in shapes.
I guess is that a factor of your body type?
For sure, yeah. It'll depend on what sort of shape the woman is starting with, and also what she hopes to end up with when everything is done. The two basic shapes are what are called round implants. Those are the more traditional ones. And then the newer are called form stable, or like a teardrop implant. So those mimic more the natural shape of the breast. And for a lot of women who are looking for a really natural result, something that's less noticeable to an onlooker, that can be a really good choice for them.
Well, I was going to say that I have over the years had male friends who've had girlfriends who've had implants, and they said, boy, it's like hugging somebody with two grapefruits. I mean, and this would be the round.
Right.
Almost certainly the round, but any implant that's really large with respect to the woman's natural size can seem like a melon on the chest. And that's certainly not the type of look that I would prefer, and most people come to see me particularly looking for a natural type of result.
But they also said that they were hard.
Yeah, and that was more of a problem with the older implants, developing something called a capsular contracture, like tight scar tissue around the implants. That's much less common these days with the newer generations. They really have improved a lot in the last 20 years.
So tell us what's changed.
Greater variety of sizes and shapes, so they really can be customized to the woman's own size and what her goals are. And then better technology. There are what are called textured surface implants. They've got a fine textured coating on the outside, and that helps to prevent some of the problems with scar tissue and contracture that we used to see back in the older days.
Now, I'm sure when people come in to see you and, they know what they want to do, and you must have to do some, because there are different types and different sizes and shapes, and you have to do some counseling. But are there ever people that come in and they say, you're doing your best to lead them the way that would be best, and they don't take that route? Do they ever have to come back and get things adjusted or changed after the fact?
That certainly happens. Fortunately, by spending a lot of time in the consultation prior to surgery, that's really rare. It does come down to a lot of expectations management, talking about what will work well over the long term and what might not. But there's certainly people who'll come back after a period of time and say, yeah, I might like a little bit of a change in size.
How big, now when you go in for this procedure, I don't know if over the years it's become either I don't want to call it simpler, but a less complicated operation. How big an operation is this?
For most women having their initial breast implant procedure, this is a very safe, quick, outpatient type of surgery.
Really?
Yeah, and very predictable. Where it can get longer and more complicated is if there's old implants that are being exchanged, or if a lift or reshaping procedure is done at the same time. If there's an asymmetry, like a significant difference in size between the two breasts, and then a whole host of other things.
Dr. Bray,
Yep.
Kate Wheeler here. We women were concerned. We did stories when we were doing newscasts about leakage. What is the latest on that?
Yeah, fortunately now extremely rare. The generation of implants in the late 80s and mid 90s, they did leak a lot. The outer lining was too thin, and they did tend to leak or rupture. The newer ones, the outer shell is much tougher. Implant leakage, rupture, breakage, extremely rare. I haven't seen that happen with any of the new generation implants. So much less of a problem than that used to be.
Well, that's good news. But what about age? We hear that some teenage girls want to get this done, or they're worried about the way they look. They think it will improve things. Is there a lower age limit that a good surgeon will not perform this operation on?
I do think there is. Probably the most important factor is that the woman's breast development be complete. Her size, shape, everything is stable, that she's in good physical health and has realistic expectations. Now, as to what that absolute age is, that might vary a bit between people, but typically for me, I don't see anyone coming in under the age of 20. And as I said before, most of my practice now is women who are a little older and have a clearer idea of what they like to achieve.
When the girl is younger, though, and, younger, early 20s, perhaps has not had children yet, and then decides to have a family, does the pregnancy affect or change the positioning, or does it shift? Can there be problems that way?
It doesn't change the implant or the implant position per se, but the breast itself can certainly change as if it normally would with any pregnancy. So change in the nipple position, like unfortunately drooping, that can still happen. And any woman I speak to and may be having babies in the future, I talk about all that stuff.
Okay, let's talk about drooping.
Yeah.
All right. Now, is there a way to just do a lift as opposed to an augmentation? Is just having the lift going to be enough?
In many women it is, and that's become a much, much more popular option in recent years. The statistics for that have increased dramatically over the last 10 years or so, and I do a lot of those. And for a woman who's generally happy with her size, then there's no need to try to make it any larger. Just lifting and reshaping is all that's required.
What about scarring? Because I went to school with a couple of girls, and they were very large chested to the point where they had to have a breast reduction because it was affecting their back.
Yep.
And the scarring, it was a number of years ago, was just brutal.
Yeah. There are scars with either a lift or a breast reduction, and there are better techniques these days that minimize that to a great degree. And in my practice, by combining with liposuction and other means of reducing the size, I can limit that. And have a good discussion about and show lots of pictures. That helps.
Okay, well, I'll tell you what. We have to go to a break, but you brought a goodie bag we're going to delve into and just take a look at the different types of implants that are available and what they look like, what they feel like. We'll talk about that. Plus, talking a little bit about things like mammograms. We will talk about all of that when we return on What She Said on SiriusXM 167, Canada Talks.
We are back in studio, and we are sitting here with Christine, Kate, and Sharon. Christine is playing with silicone. Is it? Well, it's not silicone. Is it silicone?
Those are silicone.
Those are silicone. I got
Okay.
one too. I
They're
only have one.
lovely.
You have one,
Absolutely
Sharon. I think you
lovely.
need two.
I'm trying on different sizes under my
I
shirt
have a
here.
question. Somebody has emailed, John has emailed us in a question saying, with regards to does size matter, what happens when a woman asks for something ridiculous, like, a set of 64s?
Yeah, easy answer, not to do that. In my own opinion, the implant chosen has to respect the woman's own breast size, chest size, proportions, and with really large implants, they do look, completely fake and artificial, and also higher chance of problems with those too, so I just wouldn't go there.
I know, but would you say no to a client? If a
sure.
client comes in and says, I want to be a double D. I've always wanted to be, whatever. And you say, well, really? But she said, no, if you're not going to do it, I'm going to go, because she's going to go, someone will do it, and you'll refuse?
Oh, sure. Not unusual. And, ultimately I have to be comfortable and feel that I can generate a quality result with what I do. And, there are people who I can't really comfortably assist that way.
And that's so important to listen to the doctor. There's someone I know who's a wife of an acquaintance who didn't take the advice of the doctor, found someone to do what she wanted. She's a petite woman, short torso. She ended up getting these implants, felt really fat afterward because her torso was her chest was her whole torso, and ended up having to go and get surgery to get them removed because she really, what she thought she wanted and what it really turned out to be were two very different things.
So there's saline and then there's silicone. So what's the pro, con, or is there a choice, or what's everybody doing now? What's changed?
Sure, there is a choice. Both types are available, and one factor for some people is cost. The saline ones are less expensive because they are filled with saline, simple water. The texture isn't as natural, and sometimes rippling or waviness is more visible. The silicone ones, they hold their shape better and have a more natural feel or consistency. So a lot of women prefer that, and certainly these days that's by far the most popular choice.
Is there a life on these? Like, is there a limit to how long they'll last?
There's no exact limit. You will read on the internet that it's 5 years, 10 years, or whatever, but that's not true. With time, they may need a replacement, a revision, a modification, but if everything is great and the woman is happy, there's nothing to do.
So do they interfere with mammograms?
No.
Because I've heard that, you have to let your doctor know. I mean, they do take the mammogram slightly differently, knowing.
That's right. So that's the important thing. To do a quality mammogram, different views, a different technique is required. A skilled technician will know how to do that. And the quality of the mammogram is pretty much as good as if you didn't have the implants.
So what about reconstructive surgery after a mastectomy?
Very popular and becoming more available to women as an option now that they know more about it. And it can be a tremendous assistance to recovery from cancer, self-esteem, wholeness, and just closure on that whole treatment process.
don't mean to hog the mic here, but
That's okay.
the reason I'm asking is because I'm involved with a charity called After Breast Cancer. And when I heard the stats, I was absolutely shocked that only, I think it's less than 10% of women actually have reconstructive surgery. Now, I'm sure part of that is for medical reasons. What would make it impossible or what would make it difficult for a woman to have her breasts reconstructed? Because I can't imagine not doing it, because it is so tied to our self-esteem.
Yeah.
Sure. Well, from a medical standpoint,
Exactly.
yeah, certain things like the type of treatment, radiation treatment, for example, can change the options. Also, for women who had serious cancer, like very high grade, surveillance or monitoring over time may be easier without the reconstruction done. That's less of a factor, though, and now with more options available, most women who are interested in reconstruction, there is a solution that can help them out.
So now, let's get to the men.
Yeah, because men have breast issues too.
Yeah.
Yeah, they've got too much of maybe what they don't want.
Yeah.
Yeah.
And I never knew that there was an option for men. And is this new? What's it called?
Gynecomastia is the medical name of enlarged male breasts, and it's an extremely common problem. And 40, maybe even 50% of men will have some of that over the course of their lifetime. Now, it is and has always been a common thing, but becoming more awareness of it now through the internet, and also knowledge that there's good options available to treat it.
Wow.
Which are?
What I'm doing is an advanced type of liposuction called Body Tight that allows me to reduce the fullness in the chest, but do it all through a small incision out near the underarm. So that avoids making scars on the front of the chest, which was the traditional way of doing it. But men typically don't want any sign that they've had surgery done there, and keeping the scars remote as possible, I think, is a big improvement.
Well, I would think so, because whereas a woman who has some kind of, even if you have a scar, we're wearing bikini tops or we're wearing full-piece bathing suits, whereas men who are going to the beach are just wearing trunks. So there is, I guess scarring would be so much more obvious.
Absolutely.
Yeah, men are expected and often interested in being without their shirts on at the pool, at the beach, at the gym, these sorts of places, and it can be a huge burden on their self-confidence and self-esteem.
So do you find the number of bookings for this has increased? Because I hear that more men are going to hairdressers and having their hair dyed, whereas 20 years ago they aged naturally, whatever.
Yeah.
Yeah.
More men are going and having manicures.
Well,
more
it's
men
okay,
are.
you know?
It's absolutely
men are
having
recognizing
facials. It's
that it's
okay.
Yep.
Yeah.
So I'm wondering if you've seen a dramatic increase, in the time that you've been practicing.
Yeah.
Because if I were a guy and I had them, I'd go.
Yeah.
Sure. It's been a huge increase in my practice. Over the last 2 years, an increase of greater than 50%. And it's now one of the most common, most popular things that I do. And the internet has played a role, because men, when they get together, they don't talk about these things, but being able to research anonymously and get quality information, that's helped a lot for men who are seeking solutions.
So why don't we just repeat that again, because we've got listeners all across the country, and they might not come and see you because of where you're situated, but they could at least find out if a cosmetic surgeon in their area is able to do this if they're interested. It's called, again?
Gynecomastia.
Gynecomastia.
Yeah.
Okay.
And there are lots of good resources, and
And it's healthy. It's fairly safe.
oh, extremely safe. Yeah.
And so they just walk in and walk out. Is it one of those, or is it a week's recovery time, or
a bit of soreness in the chest, but they're home the day of the surgery, doing light activities right away. And a lot of men describe it as if they'd had a heavy workout at the gym, bit of aching and soreness, but Tylenol, Advil, and taking it easy. That's all they need.
And before we run out of time, I just want to quickly get back to, if women are considering going and getting, whether it's augmentation reduction, when you're dealing with a surgery like this and we're heading into summer, how much of a recovery, a healing time is there? Because in summer especially, you're thinking about going to the beach or in pools.
Sure. to be feeling good, fully active, without any restrictions, probably about 6 weeks is a good ballpark. You can be looking and feeling pretty good before that, but if you wanted to be lounging around on the beach or swimming in the surf, you need a little bit more time.
We want to
let
avoid
everything settle.
infection.
For sure.
And all that
Absolutely.
kind of thing.
Yeah.
Very good.
That's great. Well, so even with, for example, chlorine in a pool, it would be 6 weeks after that you'd be okay for the scars?
Oh, less than that for most people. Maybe even just a couple of weeks, but
Wow.
they
Just
won't
to be ultra safe.
Yeah. So they would have had to return back to their surgeon, confirm that the healing is good, and at that point give a clear go-ahead.
Nice.
Okay, well, we're just deciding on
You know,
size
have
here.
you, have you, have you
never
noticed
felt-
that Christine and I have not put these things
I've
down?
not put these
since
down.
we
This
got
is
them?
like those, you know, those things for stress where you squeeze. You know those. What I don't know what they're called.
I don't know,
you
but
sometimes in an office, you know, they're
Yeah,
in various
stress balls.
bright colors.
I kind of-
What is it?
Stress balls. Yeah.
Stress balls. Yeah, it's like a kind of a stress ball.
I just kind of feel like a guy.
yeah, just kind of like.
I'm not going to go there.
Oh no.
I'm not going there at all.
These are fun, though. Hey.
Yeah, you take this around and say to a guy, if you have one this size, go and see the doctor. Get it removed.
Look at her. She's coming up with it as a diagnostic tool. But very
Okay.
good.
This is actually not a laughing matter, but we're having some fun with it because surgery is serious,
It
and
is.
you should go to a good doctor, check him out, and do your research and be ready for it. It's not like putting makeup on and taking it off.
No, that's
Good
for
advice.
sure. Well, thanks for joining us, Dr. Bray. It's been a pleasure, and we've learned a lot.
Thanks
And you
so
know
much.
what? Dr. Bray's coming back, I think, in a few weeks. He's going to talk to us about other things for the summer, like contouring, you know, butt lifts and all that stuff. You know? Oh.
So we will look forward to having you back again.
Looking
See you
forward.
very soon. And hey, you, don't go away. We're not going anywhere. We'll be right back after the break with more on What She Said on SiriusXM 167 Canada Talks.